Hello everyone! Today's video is about the surgical suite or operating room or our experience and how to get used to it. If you are working in the medical device industry, and especially if you're a medical salesperson, selling medical equipment, surgical devices, there is a high chance that you are going to spend some of your time, or maybe most of your time, in the OR or operating room. And for a beginner, someone who doesn't have a medical experience, a medical background, it might be very challenging for the first time to go and see surgeries, to see blood and some graphic images, patients cut open on the table, so you need to be prepared for it. And I'll tell you how. But before we begin, don't forget to subscribe to my channel, leave me your comments, questions below. Well, you know what to do, and thank you so much. The reason why I made this video, I got these questions a few times. How do I deal with a surgical environment? How do I get used to surgeries? I've never seen surgeries before. What do I do? And it is true, because I know stories and examples when pretty tough big men were fainting in the surgical suite just from what they saw or what they experienced. And I cannot blame them, because if you are not conditioned to it, if you have not seen it before, it might be quite challenging. It might be shocking at first. Like, for example, orthopedic surgery. Orthopedic surgeries can be very graphic. There can be blood flying everywhere, pieces of bone jumping off the table. So it can be quite interesting to see for the first time. Or let's say plastic surgery, reconstruction of the face. If you look at the patient on the table, sometimes it's hard to see where is the nose, where is the chin, the cheekbones. It's not pleasant, because the skin can be peeled off from the face in order to reach to the skull. So it messes up with your brain a little bit. So definitely need to condition yourself and be prepared for something like that. And I can tell you how you can start doing it, because it was easy for me. I have a medical background, so for me it was just actually exciting thing to do. I'm like, oh, I want to see this, I want to see that, I want to see that, I want to see more. I'm dying of curiosity. But I know for some people it can be challenging. So in order to get used to it, you can follow a few steps. If you're not like me, and if you have not seen a lot of surgical procedures before, and if you're not keen on seeing what is it inside of the patient, my first recommendation would be to start watching videos. Videos are helpful because they will train your mind to get used to certain incisions and looks of internal organs and some of the devices and equipment that is being used. So I think it just gives you a good understanding what's going to happen. I would say start with, I don't know, YouTube probably has some. I actually believe I've seen some procedures on YouTube, and they're quite graphic, and they're still out there, where you can see some internal organs and you can see some procedures. You can start with procedures like eye surgery. Eye is one of those organs and people freak out when they see it for the first time, because it's just our brain projects what you see on what can be done to us. So it gets very strong feeling like, ooh, I don't want to see it, I don't want to look at it. It's just a natural reaction that we have. So to fight that, just watch more videos, and you'll see, like, after watching, I would say a few, you will start feeling better. So the next step obviously is to go and actually see procedures. And when you are in the surgical suite, you need to, first of all, I'd say, tell the surgeon that you have not seen a specific procedure before, and maybe they can tell you a little bit more about what you can expect from the procedure. Because when you have an expectation, I think your brain comes down a little bit, so it's not as shocking when you see what's happening. I would also suggest to read about procedure. If you know what you're going to, read about it somewhere. So again, you have that expectation, what you're going to see potentially, what organs you're going to see. Obviously, if it's a neurosurgery, are you going to see any brains? If it's a heart surgery, are you going to see heart? If it's a liver surgery, how the liver looks. So I think having an expectation helps. One more thing is potentially you will feel the smell in the surgical suite. You might, because when surgeons are coagulating the tissue or they're closing down the blood vessels, there is a strong smell that you can actually sense, and not many people can deal with it. In those cases, just step away for a minute or step away from the surgical field. Don't stay close to it, and just try to have a breather. And if you feel very badly, leave the room for a little bit. Nobody will judge. Walk away for a little bit. Don't wait till the moment when you can actually faint. So walk away for a few minutes and come back. And of course, the more procedures you're gonna see, the more surgeries you're gonna look at, the less reaction you're gonna experience. And I am promising you that, because our brain is an amazing mechanism that can get used to pretty much everything. So once that visual input that's shocking at first then becomes less shocking, then it becomes even normal, and then potentially you will be like me, even more exciting. Okay, what are we gonna see now? What are we gonna do now? What else can be done? So you will become more curious about procedure and surgery rather than being like, oh my god, I'm gonna see something completely disgusting. I hope this was helpful. Please don't forget to subscribe to my channel, leave me your comments, questions, and I'll see you in my next video.